Good evening and welcome to tonight's Facebook Live. I'm Louise, I'm one of the clinical nurse specialists here at Breast Cancer Now, and I'm delighted to be joined by my colleague Catherine, who's
Hi.
also. So this evening is really a general Q&A session, and we have had some pre-submitted questions which we'll move on to shortly, but just a bit of housekeeping before we get started. Please post any of your questions or comments in the comment section, and we'll try and get to as many of those as we can this evening. We've got about half an hour or a bit more, but we'll try and get as many answered. If we don't manage to get to your question to answer it live, we will be replying to that. Now, we'll do our best to reply to it tomorrow. If we don't manage tomorrow, then it will be Monday we get the reply back to you. Also, just to let you know, if you don't want to post that it's a public space. So if you are posting a comment, just be mindful that it is a public space and other people might comment. But for those watching, just be respectful and non-judgmental in people's comments. But if you didn't want to post a question, but you want to speak to one of our nurses, the helpline will be back open tomorrow at 9 a.m. And the number is 0808 800 6000. We do have an answer phone, so if you wanted to leave us a message tonight, we will get back to you tomorrow. And I think I'll probably just kick off, which I suppose some of you may be watching, or most of you may be watching, may be aware that it's Breast Cancer Awareness Month. October is all around sort of just being aware of the signs and symptoms of breast cancer, but also the impacts of a breast cancer diagnosis. And I know me and Catherine were talking about this yesterday, the 1st of October. I know I certainly follow a lot of people in the world of breast cancer. So my Instagram and Facebook lives were full of sort of being breast aware, breast cancer, and I know the TV, radio, press has also been quite overwhelming. So just a bit of sort of to be mindful that for some it can be triggering, it can feel a lot. And if you do feel that it's can't get my words out, triggering, and it feels a lot, then it may be about sort of coming off of social media for October, or just sort of dampening it down, just to dampen some of that noise down. Because I know in the past, and we do support events, that people that attend those can feel October can be a lot to cope with. Is there anything else you wanted to add to that, Catherine?
Yeah, I mean, it's absolutely great, isn't it, that you see people raising money for us, for other charities that support those that have got a breast cancer diagnosis or are affected by breast cancer. But when you're in the thick of it, when you're newly diagnosed, when you're going through treatment, or even when you finish your treatment and actually you think things are feeling a bit more settled, then that trigger of seeing all of that. And, my area of expertise is in secondary breast cancer. And, we have an awful lot about, we try and get that in as well, but sometimes people do feel a bit lost and maybe not represented. So we trying our best, and certainly, although we've said there's lots of social media and you might want to dampen things down, maybe it's about looking to where you're getting your information. And we're certainly doing an awful lot of giving information this month with a lot of Facebook Lives. So keep an eye on the Facebook page, and maybe there is something that you'd like to just check in with, like tonight, the Q&As or different topics. We'll tell you about the next one at the end of the session this evening. But it is about self-care. You're absolutely worth it. So do look after yourselves.
Yeah. So, without further ado, I think we'll go with the first question that's been submitted.
Yeah, so I've got one to ask you, Lou, from Ruth. And she says, I've got a rash near my nipple, had a mammogram 18 months ago, which was clear. So should I still go to my GP? Quite a few people ask us this, don't they? Because they might have just been for their screening, if they're of a screening age. And then they notice a symptom, but think, oh, well, it was clear. So do I need to go?
Yeah. And in some ways, absolutely right. We often hear from people on the helpline and our Ask Our Nurse service this exact question. And I think if you've had a mammogram, that's great that it was clear, but we would always say, if you get a new symptom or a new change that wasn't there at the time, or even if it's a couple of weeks after your mammogram, it's really important to go and get that checked out. More often it's not anything to be worried about, but certainly it is about going to your GP. And some of the other sort of, certainly a rash or crusting around the nipple could possibly be a sign, but it may also be a sign of something else other than breast cancer. So I think sort of, again, it's really important to be sort of breast aware. We often say, and it sounds like you are, but being breast aware is sort of touching the area for feeling for any change, looking at your breast. So if you're looking in a mirror, getting used to doing that. And if you do notice a change, it's about going to your GP and reporting that. The GP will check your symptoms, and if they feel, sorry, my screens have just disappeared. Am I still there?
I can still see you, Lou.
Yeah, there we go. Got you back then. If the GP is concerned, they may well refer you to a breast clinic. So it's slightly different from the screening system. There's a symptomatic. If it's symptomatic, you would be referred to a breast clinic, and then you might get seen by a nurse specialist or a breast surgeon. They would examine you, and they may well send you for another mammogram, even though you've had one 18 months ago, just to check it out. Or they may not. They may look at it and they may feel it's not necessary to have any further tests. But certainly you can have a look on our website, and there's further information about some of the signs and symptoms. And it's a really important one to raise, actually, I think, because so many people just think it's a lump to look out for. So other sort of signs and symptoms that if people are watching and they're not sure, it might be an indentation, it might be a change in the colour or shape of your breast, inverted nipple, if that's not something you've always had. So if you just notice anything that's new or unusual for you, then it's really important to get it checked out. But certainly I would let your GP know.
Yeah, for sure. And I suppose it's right to say that we know that mammograms are 100% accurate, and that's really is the rationale by saying even if you've had one within the last few weeks or months, the changes can still happen, and we would always want to make sure that it gets checked out and isn't left unchecked, just in case there was anything that you could see but you can't actually see it on a mammogram, and it comes to light that time afterwards. So it's always been making sure that you take that precaution and get everything checked out if they've got a new change since that mammogram.
Yeah. And I suppose the other thing to mention is it may well not be a breast issue, it could be a skin issue. Yeah. So it may well be that the GP looks at it and feels that there's something going on, whether it's sort of an eczema type thing or
there are quite a few people that get eczema, aren't there, in and around the sort of nipple and areola area. So yeah. Okay.
So the next question we've had in is from Ali. And she says, I've been experiencing pain in my hip for a while now and no obvious cause. I finished treatment for breast cancer nearly 10 years ago now, but have heard that breast cancer can come back even after a long period of time. Do I need to report my symptoms? And if so, who do I report them to?
Yeah, you've made a really good point there, Ali, because we know that when people have had breast cancer treatment and they finish, quite often some years afterwards, either they themselves or maybe sometimes their GP or family, they assume that anything else can't be related to the breast cancer. But unfortunately, we know that breast cancer can come back and can come back many years afterwards. So it's still relevant to continue when you've had primary breast cancer and treatment for that, to still be vigilant and to know the signs to look after. So we've got some good look out for. So we've got some good information on the website. It sounds like you've noticed this hip pain. Sometimes people get changes that are completely unrelated, obviously, to their breast cancer. Some people do find that they have side effects that can mimic symptoms of secondary breast cancer, but that's what we might call a red flag when you've had a primary breast cancer and you've had treatment. That if you've got a pain and there isn't an obvious cause, which is what you said, Ali, then we'd always say to get that checked out in the same way as we've just discussed that other symptom on the breast that Ruth mentioned as well. So just be aware that people can have develop recurrence and can develop secondary breast cancer some years afterwards. And there's some, as I say, good information and changes to be aware of after breast cancer. So things like hip pain, backache, any other pain in the long bones. A lot of times when people explain that they've got pain in the bones, then they often describe it as being worse at night and not particularly doesn't particularly respond to taking simple analgesia. So we're sure to say to you, Ali, to report this to your GP. And quite often people are a bit worried about going back to their GP. They think that their GP might dismiss them. But it's important to remind that GP that you have had breast cancer before, just so that they can take that into consideration. This may well be absolutely not related to your breast cancer. People get arthritic changes, all sorts of changes. But report it to your GP. Some people might still be under the hospital. So you said that it was 10 years ago. You suspect you won't be under the hospital now from a breast cancer point of view. So it might be that your GP has to refer you back, but getting that checked out is really, really important. And then you can either be reassured or obviously things can go from there.
Yeah. Right.
We've got a few other questions in at the moment. I'm just looking. There was a great comment, I think, from Leslie, just on the back of the mammogram discussion that we've had with your the first question from Ruth. Thank goodness for mammograms. It was a mammogram that picked up the lump in my breast, and I'm going through my journey now. So, yeah, an awful lot of people feel that the mammogram is what spotted things early for them. We know that the earlier we can spot breast cancer and find it, and the earlier you can get treatment, then the more likelihood of having a positive outcome and that treatment will be successful. So, good to know that you went along for that mammogram, Leslie. And just remember that we're here, the number that Lou said at the beginning, the helpline, and lots of other services to support you through your journey, but also the other side of that as well when you finish treatment as well.
Yeah, absolutely. And then I think Angela says, hi, I've had surgery in March, then radiotherapy. I finished July. And now on an anastrozole and have been offered ribociclib, but unsure due to side effects. Angela doesn't say what side effects, but I'm wondering if it's the sort of tummy side effects and the sort of we know that ribociclib, for those that aren't familiar, is one of the side effects is the you can get diarrhea with it. So I wonder if that's the sort of worry that you've got, Angela, and I suppose it is about sort of giving us a call, because it might be that we can give you a bit more on over the phone on the helpline around that and talk to you much more in detail. But it might be worth talking to your treatment team, because these are all possible side effects, and not everyone will experience all of those side effects, and they may experience them, but to a lesser degree. So is there anything else you would want to add to that, Catherine?
Yeah, I suppose we've moved into a time where people are offered their hormone therapy, so your anastrozole, which is there, Angela, to be able to lower your the amount of estrogen that is made in your body, because your breast cancer has obviously been a hormone sensitive one. And now we've moved into sort of this time where we can add in what we call this CDK4/6 inhibitor drug, ribociclib, and there are another couple of those drugs. And the three of them are actually used to treat secondary breast cancer, but a couple of them have come in. So abemaciclib and ribociclib have come into use for people with early breast cancer. So the people that would normally be maybe on just hormone therapy, to give them some extra benefit. But like anything, it has got to be a case of balancing the benefit of that against the potential side effects. Abemaciclib particularly is bad for diarrhea, and I know ribociclib can also affect the heart in some people as well. So it could be any manner of things, I suppose, that Angela is worried about. The other thing to say is, whilst we might not have specific volunteers on our Someone Like Me service that have been having ribociclib, that's quite a new use recently, but abemaciclib has been used, and it may be that we have somebody that's on our Someone Like Me volunteer service, so they're trained volunteers to support people and just share their experience. Then it might be useful, Angela, just to ask those practical tips. As Lou says, speaking to your team about your concerns about those side effects, how they might be managed is one thing, but actually getting it from the horse's mouth as to how it's been to be on that sort of thing can also be helpful. If you want to know any more about that and talk that through, as Louise said, just give us a call on the helpline and we can arrange those things. So. Yeah. Okay. Next one that's just come in now is Yvonne, and she says, I had my lumpectomy and node removal on the 11th September, so not too long ago now, Yvonne, after being diagnosed with 15 millimetres of triple negative breast cancer. How long before I'm contacted with the results? We hear quite a differing sort of lengths of time, don't we, about with regards to sort of how long people are taking. It is taking a little bit longer than probably historically it has done in the past. What could you say about that, Louise?
Yeah, it's a really difficult one to judge because again, I don't work in clinical practice anymore and haven't done for a number of years, but I know it used to be around sort of 10 days to 2 weeks. But as Catherine was saying, I was on the helpline this afternoon and I had a lady said she had to wait 5 weeks for her results to come
That's a
through.
long
So
time, isn't it?
yeah, I think the best, which is really difficult because
Yeah, it
you're
is.
having the surgery and then you're sort of waiting really to find out what the next steps are. You might have been given some information about what they possibly may be, but understandably you want to know that has the surgery been completed and what the next steps are. I definitely would probably say to give your breast care, if you've got a breast care nurse, to give them a ring because they will be able to give you a timeline as to when that is likely to be. Because it's sort of, yeah, I suppose you're at I'm trying to think back how many weeks, it's sort of nearing 4 weeks, isn't it? 3 or 4 weeks since your surgery. So, and I don't think it's unreasonable for you to phone the breast care nurse. We often hear from people saying, I appreciate they're really busy, I don't want to bother them. Absolutely, that's what they're there for. So it's really important if you haven't heard anything, give them a ring and say sort of when is it I'm likely to get my appointment, my results. I wonder if you've been seen as a sort of a wound check as well, because again, it's important that if you haven't, it might be that they want to have a look at that and see how you're healing.
Yeah, but it does help, doesn't it? Even if you're going to have to wait that little bit longer or a little bit longer than you might anticipate, just to have some sort of timeline rather than no timeline at all. Again, if you want to give us a call and just talk through how you're feeling about that and you've got any questions, got some good information about understanding your pathology report when you do get that. So that might help you understand that as well. But yeah, do give us a call
Yeah.
and have a chat through that as well. Um,
And
did you want to, go on.
the next one's a sort of similar theme, really, and I think it might sort of apply to some of the things we've just said. Men has asked, I'm going to see my oncologist on Monday for the first time. How soon after do they start the treatment for chemotherapy?
Yeah, and so traditionally that usually should start within about a 31-day period, but obviously everybody is different. They need to sort of be healing, particularly when you're having chemotherapy, which can affect the tissues and their healing ability, because what it is doing is actually killing off both cancer cells, if there are any there, and also normal cells as well. So around about 31 days, but that sort of starts and counts from the time that the oncologist and yourself has agreed to that. And we know, again, resource and capacity, there will be changes in that. But, it's still not unreasonable to be asking about that timeline, knowing what to expect, and also getting information to be able to prepare. And, I've mentioned our Someone Like Me service previously. We've got lots of volunteers that have got experience about chemotherapy. So it might be that people sort of use that time to be able to prepare themselves, but also just staying in touch with the hospital and your breast care nurse and just checking in and making sure you know what to expect and when that chemotherapy might start.
Yeah, and just another thing to mention, when you do start on our forum, we have a monthly chemo starters section. So say you were starting in October or November, there's an October sort of chemo starters. So everyone who joins that sort of forum posts are around about the same time. So again, it is a bit about that peer support. So it's something you could post a question on the forum and just sort of say, I'm here, or I'm struggling with this, and it's that sort of backwards and forwards. Are you getting that, or what support did you get for that? So again, it's another level of just sort of support for people that are probably at similar stages going through their treatment.
Yeah, okay. Did you want to go back to one of the other sort of pre-submitted questions? I was just keen to sort of answer one that came in from one from Lucy. Is it Lucy or Tracy? We've got two.
Tracy, yes.
Yeah.
Yeah, shall I ask you? So Tracy
Yeah.
said she was diagnosed with secondary breast cancer 6 months ago, and she's getting used to medical treatment, which is letrozole and ribociclib. But she's wondering if there is anything at all she can do to help herself apart from just taking the drugs.
Yeah, an awful lot of people ask us this. They feel that sort of control is completely diagnosed, and think with primary and secondary breast cancer. But we hear an awful lot from people with secondary breast cancer diagnosis that just feels as if the rug's been pulled from underneath them, and things do get going, and medical treatment starts, and they're not really sure what to feel. There's an awful lot to think about, including their outlook and the future and what that might look like, and the fact that there's so much uncertainty. So actually thinking about what you can do for yourself is really important. And I think more than ever these days, we are trying to deliver that information and give people an idea of what they can do for themselves. So your medical treatment is really, really important, and that's evidence-based. And we know that everything that we give to people has got evidence behind it to say that should be good benefit in that, and your oncologist should talk that through with you. But if you've got a breast care nurse or a specialist, maybe secondary breast cancer nurse, it'd be a good idea to have a chat with them. Things like physical activity are really great. We know there's evidence for those that have had a primary and early breast cancer, and the benefits of that, and we've got no reason, and there is a little bit more evidence to think that for those with secondary breast cancer, then physical activity is really good. So getting out and getting some fresh air and doing some physical activity, and we don't mean joining the gym or running marathons, we mean just getting out, walking the dog if that's what you do, doing some yoga. There's an awful lot of the women we come across in the services that do yoga, Tai Chi, those sorts of things that can be really good for mental health as well. Loads of people ask us about diet as well, so they're wondering whether they should be on a special diet, whether they should be avoiding things, whether they should be eating, or be aware of all those fad diets, things that people things that might pop up on your phone. You know how these algorithms work these plate that's got all of the food groups on there, and there is no reason that you can't have a little bit of something else, just like everybody else, really. A bit of cake, maybe a tiny little a little bit of wine every now and again for a celebration. If sometimes people are really on treatment, are really struggling to eat, and if all they can eat is cheese on toast or eggs or whatever it is, then for that day and that time, then that's what they can eat. But it's about getting calories in and those sorts of things if you're going through particularly chemotherapy treatment. The other thing that people ask us about a lot is herbs and vitamins and supplements. That's not something that we would advocate freely. We know that some of those can actually interact with some of the cancer treatments. So it's always about asking your team, always about asking your pharmacist before you take any of those things, just to make sure that they're not interacting with your cancer treatment. So those are a few of the things. We've mentioned peer support as well. So we have Living with Secondary Breast Cancer monthly meetups in 50 locations across the UK now, and we also have a host of online meetings. So they're discussion meetings where you can meet other people that are in a similar situation and who just get it and understand, and actually probably going to give you lots more tips than I've already just given you as well. We've got specific services for younger women as well, and in fact we've got in a couple of weeks' time, in fact a week tomorrow, then we have a 2-day event up in Leeds for younger women, so with secondary breast cancer. So that's 45 and under. So if you've got a diagnosis of secondary breast cancer, you come and fancy coming and joining us in Leeds for 2 days of information and support from lots of other women in a similar age group to you, then give us a ring on the helpline. We've also got an access fund. So if you're thinking that finance or practical barriers are going to stop you from coming, even if you've got the time and the opportunity to come, then again, let us know. We'd welcome you. There's space for you to come along next week in Leeds. So a few tips. I'm sure there is more to be able to give you there, Tracy, but a few tips to start and think about, and then you'll be able to build your own sort of your own toolkit, if you like, of well-being and looking after yourself and hopefully living well with your diagnosis.
Yeah. I'm probably going to jump down a bit just because I've noticed one, but Sally says, why am I cross? Because everyone keeps telling me about their auntie or cousin who recovered. I'm not them, I'm me. and that can feel really difficult, can't it, Catherine?
Yeah.
Where I think sort of people mean well, and they sort of almost it's in a reassuring way. They obviously want to make you feel better, and often they'll sort of say, "Yeah, Auntie so and so did this, and she's fine," and that can feel, as you say, can make you feel really quite angry because it's not acknowledging what you're going through or how you might be feeling.
Yeah, I think it's sort of quite burdensome, really, isn't it? It's an expectation that because somebody else has done it and maybe coped with it, then, you should be able to do that too. But I quite often think, we come across so many people who describe the fact that on the outside and to their friends and maybe even their family, they look absolutely fine and they say, yes, I'm fine, I'm doing fine. But in actual fact, what's going on inside is far, far from that. So it can feel really quite infuriating that people can't acknowledge, even if you've finished your treatment. And I used to find, I don't know about you, but I used to find a lot of people really struggled at the end of treatment. You stopped going to the hospital, seeing lots of people, having that input, having that support. People understand the psychological impact, the emotional impact of breast cancer, and we're prepared to sort of chat that through with you. And suddenly that stops, and everybody else thinks that's great. She's done great, or they've done great, and we're going to move on now. But, you look to the horizon and think that can be really scary to think that there's uncertainty out there. So I think, talking with us on the helpline, Sally, and also talking to somebody through someone like me service can be really helpful, that just that other peer support as well. And of course we have our moving forward services as well, to be able to give people some confidence and to acknowledge that big emotional impact that breast cancer diagnosis has had on them. So quite a few years, we absolutely stand behind you with that and say we can understand how that must be infuriating, and really empathise with that. But the support is out there, Sally. So we want to make sure that you feel supported. So give us a call, and we'll talk through what we've got, what we've got on offer for you, and just give you some time to talk that through. Just looking for underneath there. So we've got another one there from Victoria. So hi, I'm 1 year in remission from triple negative breast cancer, had a lumpectomy, chemo and radiotherapy. Is it normal to still feel quite tender in the breast area that was treated and the skin quite firm? Many thanks. So I think that comes up quite a bit, doesn't it?
Yeah. So yeah, Victoria, in answer to your question, it can be. We know the effects of radiotherapy in particular can cause the breast to feel quite tender, and the skin to feel much firmer. And for some that can last several months, but for others it might last a number of years. The only thing is, going back to the question, is it new that it's become tender, or is it still quite tender? It's still quite tender.
It's still quite tender, yeah.
Yeah. I mean, certainly we would always say if you continue to be concerned by it and it does feel firm, you could certainly go back and get your team to check it out, just to make sure that they feel that it is normal treatment related changes. But if you are sort of thinking, is it feeling that tender again? Sort of sometimes wearing a bra can feel really uncomfortable. It's important to let your treatment team know, because if you have got that ongoing discomfort, there may be things that they can do, and also things to rule out that it's not anything else or any underlying sort of infection that's going on. But certainly from a radiotherapy perspective, we do see these sorts of changes that can last quite a long time. Yeah, absolutely. If you want to talk it through in a bit more detail, you can give us a call on the helpline. Again, I know we've mentioned our Someone Like Me service, but sometimes it is about sort of, again, having somebody to say, yeah, absolutely, that's how it was for me, and it was normal. But at the same time, I always, because we can't see it and we can't speak directly to you, I would always caveat that you could always check it out with your breast care nurse, give them a ring and just say, is it something that I should be worried about, or is it just normal post-treatment related changes?
Yeah, absolutely. I've just noticed that there's a couple that we've sort of missed because we've had
Yeah.
quite a few in now. So and that's all jumped about again. But Ellie says I'm due an annual mammogram next week after having had surgery 2 years ago for breast cancer. I find the mammogram excruciatingly painful on the breast where I had the nipple removed. Any advice? That can be really difficult, particularly if you've been left with some sensitivity or sort of discomfort there, which we've talked about in a sort of a smaller space of time just now. But I know quite a lot of women find that when they go for their follow-up mammograms, then they are uncomfortable. I guess the basic things would be to make sure that you take some pain relief before you go along, and just take that in well in advance so that you've got some on board there, if that might help. But also, I used to find when working in the clinics that sometimes just taking things a little bit slower and just explaining to the member of staff and just saying, can we just take this slow? Things are often done sort of pretty efficiently, shall we say, in the clinic when you go in for your mammogram, and they're so good at what they do and they know what they need to do, but actually you just need to have a little bit of control and a little bit of time. So I used to find that quite often when people were worried, or they were worried it was going to be uncomfortable because they knew it had been in the past, then just taking a little bit of time and doing things a little bit more slowly was helpful. So it might be worth you just letting the clinic know either on the day or ringing before and just saying, I'm actually quite worried about this. It is quite uncomfortable. That sort of thing as well. It's really difficult to a magic wand to sort of make that go away, unfortunately. But just taking it slower and feeling as if you've got some control, I think, can make all the difference, and hopefully just reduce your anxiety, and maybe that may also help sort of contribute to it being a little bit more comfortable as well.
Yeah, yeah, absolutely. And again, if you're finding that you've got ongoing pain or lasting pain from the surgery, and it's sort of exacerbated by the mammogram, again, it might be worth sort of flagging that with your treatment team and saying, I've got this, is there anything that can help with that? Because we know through the surgery and treatments, there can be sort of some nerve damage. As Catherine said, it can either cause sort of hypersensitivity or ongoing pain. And sometimes there is things that can be done to improve that. So again, if it is something that is happening sort of throughout, other than just having the mammogram, but sort of in everyday life, then certainly do let your team know about it.
Yeah, and there's one that's sort of not dissimilar, except Amanda is saying that she's actually only 16 days post lumpectomy and sentinel node removal, still getting quite a bit of pain in the breast and underarm, been doing my exercises daily. Is this usual, please?
Yeah. Yeah. Unfortunately, it is, Amanda. Hopefully, you can take some simple pain relief for that. We do know that where they take the lymph nodes underneath the armpit as part of the sentinel lymph node biopsy, that it can disrupt the nerves. So sometimes it's numb immediately afterwards, and then around that sort of 10 to 14 days, it almost sort of can become hypersensitive. And usually it's sort of underneath the arm, it can be the back of the arm, and even sort of towards the back, and even putting clothing on can be really quite sensitive. So it does settle down, and for most people that will settle over time. Sometimes you can get, and again it might be a bit early on for that, but something called cording. I think you're probably too early on in the recovery stage, but it is normal, and certainly again, if it persists, it gets worse, let your treatment team know, or you can give us a call on the helpline. But we've got information, your operation and recovery information on our website that goes through sort of some of the common sort of after effects of surgery. So you could have a read of that as well.
Yeah, and sometimes people are doing really well with their arm exercises and just doing a little bit too much. A lot of people do actually recover quite quickly from their anaesthetic, from their surgery, and they really want to make sure that they get those arm exercises done. But sometimes scaling back slightly, if you think you're overdoing it a bit, can also help. So again, that might be helpful to talk that through with your breast care nurse or one of us, just to sort of talk through exactly what you're doing and see whether that might be part of the impact of their discomfort. But 16 days after, I think we would expect most people to have still some sensitivity and discomfort there. And Katie says she had her right mastectomy 21 days ago, but is still having a hard time doing her exercises. I'm worried that I won't be able to improve because of this. I think quite a lot of people also experience that sort of thing, KD, as well. If you're struggling with your exercises, sometimes that's because things feel really tight. Some people have a buildup of fluid around the area as well, particularly if they've had quite a few lymph nodes removed from under the arm, which some people still do these days. And so that can get in the way of doing exercises as well, and make things uncomfortable and tight. So I would certainly talk to your breast care nurse if you're struggling with those. It may well be that you can be referred or assessed by a physiotherapist, just to be able to have a look at what you're doing and whether you're doing things okay, how you're getting on, what the issue is there as well. If you're really struggling, you're not being able to do that, then you definitely need to speak to somebody.
Yeah. But also it's 3 weeks post-op, so don't be too hard on yourself. But it is a way of flagging it with the team, because, again, it is early days. And sometimes it is about just continuing, doing it. I don't know how many times a day you're doing them, but maybe doing it less. But as long as you've got some movement in that arm as well, it's really important. But, yeah, just let your treatment team know, because they can give you further guidance.
Yeah, okay. Did you want to sort of read out the one from Linda? Can you see the one from Linda there, Louise?
Yeah. So Linda says, I've just started CAPE as my second line after having progression on weekly paclitaxel and pembrolizumab. Do you have any recommendations for keeping nausea under control? I have metoclopramide and ondansetron, but was told to take it easy on the latter.
Okay, so yeah, this is really important because Linda, it sounds like if you've sort of started capecitabine and you're talking about second line treatment, it sounds as if you've got a diagnosis of secondary breast cancer. So it's really important that if you're on treatment and you're continuing with treatment, as most people do with their secondary breast cancer, their treatment is ongoing, that you get those things under control and get that nausea under control. So there are a raft of anti-sickness tablets that are out there. It wouldn't be appropriate for us to be able to say, take this, take that. It definitely is about talking to your team and talking about to your chemo team. And as time goes on, they will be able to change things around and hopefully find something that works. Not everything works in the same way, and not everything works in the same way for everybody in the same way. So please do. It's really important that you get that under control so that your quality of life is much better and you're not feeling miserable and sickly and all of the time, or being sick. So please do speak to your team. If you wanted to give us a ring on the helpline and talk things through, then that's also okay. But the same stands really, is we wouldn't be able to tell you what you should be taking. That is definitely up to your team. Your team know you inside out. I've got all your notes. So have a really good discussion with them, or call your chemo hotline, or emergency helpline, or whatever it's termed, wherever you are. You should have a number to be able to contact the chemotherapy nurses and have your for your next follow-up and next assessment. So don't be afraid of speaking to them in between times.
So there was one from Maureen, I think, further up, Catherine, that I don't know if we should, have you seen that one?
Oh, yes. Hello, I've had a lumpectomy and radiation. I've tried 3 different tablets and they all make me ill. Any advice? I think she means they're just interfering with her quality of life. So it sounds, Maureen, as if maybe you're on hormone treatment, and a lot of women are offered what we call an aromatase inhibitor, and there's 3 of those. So there's anastrozole, letrozole, and exemestane. And sometimes, people don't get on with those. They have got quite significant side effects. Quite often they're downplayed, but an awful lot of women describe their joint pain. They describe menopausal symptoms and just generally feel ill on them. So it's not unusual for your team to swap you from one to the other. Sometimes people find that they settle on one tablet, and actually it's the brand that makes a difference. So just be aware, anybody that's taking that out of there, then usually pharmacists will, when you go for your prescription, you may well notice you're getting the same drug, but it's made by a different manufacturer, and that can make the difference. It's just the additives and what goes into making up the tablet. It makes absolutely no difference to the efficacy, so the usefulness and the effect of that tablet. You're not having that taken away, but what is in there can sometimes mean that people do experience different side effects, and even if the letrozole that they've been taking has been fine, suddenly they change brand. So that might be one thing. If all else is, you've gone through those different tablets, then there is tamoxifen as well, which works in a slightly different way, but does the same job. So again, it's about going back to your team and just discussing those options. But you would be able to give us a call on the helpline and talk to one of our nurses about that. That's a really common thing that comes up. Sometimes people find a tablet and a brand that suits them really well, including on tamoxifen, and things settle down. But it's really important to explore all those options. So give us a call and we can chat those things through with you.
Yeah. And I would just say as well, Maureen, is certainly, again, some people worry that if they started on a drug and it's sort of what they were anticipating, are the others sort of less effective? And that's not why. And actually the studies have shown, and I was at a session at the weekend with a fantastic oncologist, and he said for the differences in some of those tablets, you're talking like minuscule, like 1% different. And actually the important thing is if you can get onto a medication that is going to give you a better quality of life and you're going to stay on that, then that's the really important thing. So but yeah, it's really important to talk that through, and probably give us a call and we can chat further in a bit more detail.
Okay. I think this is one for you, Louise. Liz says, I had a double mastectomy with the immediate implants due to having positive nodes, which had not previously been seen. I'm due to start 15 rounds of radiotherapy. How likely is it that my new implant will have to be removed?
So really important question, Liz, and this does come up, and I think it practice varies. So I think what you might be worried is that they weren't anticipating that you were going to have radiotherapy, and that's why they put the implant in. But again, different places, different surgeons, some surgeons in different hospitals will put implants in even though they know radiotherapy is going to be given. I think what you're alluding to is something called capsular contracture that can happen more so when people have radiotherapy after having an implant. And basically capsular contracture, even without radiotherapy, what happens is naturally your body's normal defense system when you've had an implant is foreign body, and it builds up a scar tissue around that, just as a sort of, that's a natural response to that foreign body. The radiotherapy causes inflammation, so that sort of scarring that's happened around the implant can become firmer, and it can sometimes, what it can do is it can sort of contract the implant, so it can either distort the shape of the breast, and sometimes that can cause discomfort and pain. Now there's different levels, so some people might develop capsular contracture and never know about it. It might not change the shape or size or get any symptoms, whereas others will. They might not get symptoms, i.e. any discomfort or pain, but what it might do is the overall appearance may be affected if it happens. It's really difficult to predict who's going to get that and who's not. And I think ultimately you've had that surgery done, and what everyone will be hopeful for is the radiotherapy doesn't cause there to be any problems. If you do notice any changes in shape, or it feels uncomfortable, or the appearance is impacted, it's really important to go back to your team and let them know. And then they would talk through the options as to whether or not that implant needed to be removed or replaced. But hopefully at this early stage, it's a worry. I know where I worked, that was standard practice. Whether or not you had radiotherapy, that would happen. So, and I know lots of units that do practice that, others don't. So it's varying practice across the UK as to what people do. So it's not unusual for people to have an implant, even if they're expecting to have radiotherapy.
Okay, lovely. Thank you very much for that. I hope I'm going to pronounce this right. Sima says, is it normal to have back pain in the lower back after active treatment? I'm now on tamoxifen and finished my radiotherapy at the end of June. I think we'd say that I can't think of any reason specifically from a treatment perspective, although some people do on tamoxifen say that they have some sort of aches and pains, certainly not as much as those that are on those aromatase inhibitor drugs that we mentioned not too many minutes ago. So it's quite unusual. But I suppose what we've got to think about sometimes is just that sort of stress and emotional impact, and both the stress and the emotion can sometimes make people have other aches and pains. So I think the bottom line really, Seema, is that reporting that and just getting that checked out would be really important to do. It's not unusual for things to other things to happen, and it's always an automatic thing that people have those aches and pains and always associate it, and it's got to be something to do with my breast cancer, whereas other things do still happen, other conditions come about, back pain, arthritis, all sorts of things happen, and not related to breast cancer, but can happen just as they would have done if breast cancer had never come into your life as well. But knowing that there is that information out there about changes to be aware of after you've had treatment for breast cancer, knowing the signs and symptoms of breast cancer coming back either in the local area or elsewhere in the body, then it's always important to get those checked out. So if it's something new and can't be explained and it is really persistent, then do tell your team, and then they've got the opportunity to check that out for you.
And just another thing, if you may or may not have attended, our Moving Forward courses cover this. So people that are within 2 years of active finishing their sort of hospital-based treatment, you can still be on other sort of treatments during that time. But certainly that's some of the things that those sessions will go through. It's around sort of some of those signs and symptoms. What should I report? And as Catherine said, that we've also got a booklet which is called After Breast Cancer Treatment, What Now? Talks about the signs and symptoms. So certainly have a look at those as well.
Yeah, that's got that information there. We've got it in several ways, haven't we? So if you're not sure how to get hold of that, you can let us know and we can point you in the right direction if you come to the helpline. And just talking about sort of thinking and looking for symptoms, then Teresa says, I had a mastectomy on my right side 15 months ago with sentinel lymph node removal, which were clear. That's good. No chemo or radiotherapy. How will I know if the cancer comes back in my chest wall? I feel quite alone as my yearly follow-up was just a phone call. I have had my first mammogram since my mastectomy. I did ask, but I was told it's my responsibility to check. I'm also on letrozole and have osteopenia because of letrozole. So, I'm going to go backwards there. We know, Teresa, that letrozole can cause a sort of a reduction in bone density. So from the age of about 35, us women, our bone density and strength does tend to go down. But when we put somebody on something like letrozole, when their estrogen in their body is being suppressed and you don't have as much estrogen in the body, then your bone strength is also can be affected as well. So it's quite important for you to get some lifestyle advice. We've got some information on our website about osteoporosis and breast cancer treatment, but osteopenia, that would still be relevant. You can help yourself by your diet and making sure that you get enough calcium and vitamin D, those sorts of things. And there's some good information on about what lifestyle. So just thinking about that, and hopefully that your osteopenia doesn't develop into osteoporosis. So have a look or give us a call as to where and ask us where to find out about that. I think, that whole no chemotherapy, no radiotherapy and just surgery is really difficult, isn't it? Even if you're off, taking your letrozole, then it feels as if sometimes it's been quite a quick journey through there. And it's probably good news that you don't need that chemo, you don't need that extra treatment, but you do miss out sometimes. People feel they've missed out on that opportunity to speak to people and speak to nurses, doctors, have questions answered. And then, it just feels quite lonely when you're sort of pushed out there to be on your own. These days, then the mammogram is the best way on the other side to be able to check for any recurrence, and there won't be obviously a mammogram on the other side where you've had the mastectomy. So that's about getting to know that scar. You're still only 15 months on, so there still will be changes going on that scar, Teresa. So it's a bit difficult sometimes to know what's just part of the healing process, what's part is scar tissue, that type of thing, and what might be something. But rest assured, if you're worried about that, then contact your team, contact your breast care nurse to check that out. But you're looking for anything that looks different or anything that feels different and is persistent, changes in colour, any sort of breakdown, any weeping, or any new sort of lump. Do you want to add anything else in there?
Yeah, and this is a question that comes up again. I mentioned the moving forward, but we do a Q&A session on the moving forward, and often people will sort of say, when we sort of say any new lumps and bumps, and they'll say sort of, well, it feels lumpy and bumpy after the surgery, and the scar can feel very lumpy in those first couple of years as well. So, and I always give people permission, because they always sort of say, I don't want to come across as neurotic, I don't want to bother my team. I worked as a breast care nurse in practice for over 15 years. I would much rather have my patients have said to me, I'm not sure what this is, and seen them or spoken to them on the phone, got them in and said, that's normal, and reassured you. We absolutely get that it can be worrying, it can feel isolating, and you don't know who to turn to if you've got worries. So, and in this sort of early stages, it's you want those sort of safety nets, and you want to know sort of who you can go to for reassurance. You can even ring us on the helpline as well. Somebody can talk you through that, because certainly, we often hear. And talking about that sort of isolation, again, we've got a couple of speakers' lives coming up, and I think it's about that sort of uncertainty as well. So we've got one on the 29th of October with an amazing clinical psychologist, which is coping with uncertainty. But we've also got one, it's not until the 18th of November, but anxiety after breast cancer. So, and you can go onto our website, put in speakers' lives, and you can register to watch those webinars, but you get the opportunity to post a question, and that would be answered live. So that might be for anyone who's watching things that may be relevant for you to log on to. And I don't know if we do speakers lives for primary breast cancer, but we also do them for secondary as well.
Yeah, I was going to say, then you just need to make sure that you're looking for the right ones. We definitely have some for secondary breast cancer. We've done something recently. I think one of our lovely therapists, Ali May, did something on managing worrying thoughts. And so we repeat these there's one on sex and intimacy that hasn't been asked about this evening, but we've got one of those coming up, and also about research as well. So lots of those, and keep in touch with us. If you register for our services for secondary breast cancer, even if you're not going to come on a regular basis, you will get the updates about what's coming up, so that you can pick and choose. And the same with primary breast cancer. Just keep an eye on that page just to see what's coming up. And quite often there are things that you didn't necessarily think you wanted to know about, but it might be that there's just something there at the right time, particularly with the emotional impact of a breast cancer diagnosis, that can be really helpful. And to have that expert give you some advice and some tips about managing those sorts of things as well.
So I think we've answered most of those questions that are in, and we're at 50 minutes. I said we'd only be around for about half an hour or so. So we've had lots of really good questions. Just to say that we've got a couple of Facebook Lives coming up next week. We've got one on Wednesday, which is on risks, myths and misinformation, and that's at 7 p.m. on Wednesday. And then we've got one on psychological support next Thursday with two of our clinical nurse specialists. So again, we will be putting posts out just as a reminder, and if anyone wants to pre-submit questions, feel free to do so. As I said at the beginning, and we've mentioned all the way through, you can give us a ring on our helpline if there's anything we've discussed that you want to talk through in more detail, or you can also put in a response through our Ask Our Nurse service through the on our website as well. I don't think, is there anything else before we sort of say
no,
goodnight?
I was just going to put in also a bit of a picture. So we said that we got quite a lot of Facebook Lives throughout this month of October. So we were telling people to look after themselves at the beginning, but we're also saying we've got lots out there as well. So do be a bit picky and choosy. But if you have got secondary breast cancer, you might be interested in Monday the 13th. So that is Secondary Breast Cancer Awareness Day. So we do something sort of specific on that day, but obviously we want to make sure that secondary secondary breast cancer awareness is there for 365 days a year, not just once on the 13th of October. But I will be joined on a Facebook Live with Louise, who's a clinical nurse specialist in the NHS. She's in Luton. So we're doing a Q&A just like this evening, but it will only be on secondary breast cancer. So if you've got more questions that you want to ask us, then you can ask us then. And then right at the end of October, on the 27th, I think that's also a Monday, then Mel from Make Seconds Count and the clinical trial service that she runs for them will also be with me. So we'll be talking about clinical trials for secondary breast cancer then as well. So keep an eye on the Facebook page and lots more. And also just to say, yes, there's a helpline, and yes, there's the Ask Our Nurses service that is there on the website, but you can also send us direct messages via our Facebook, Instagram, Twitter, or X as it is now, and those sorts of methods as well, and they will come through to us as nurses and we will respond to them.
Yeah.
So yeah, I think that's everything.
Yeah, so thank you everyone for joining us this evening. Take good care of yourselves, and good evening. Have a good your evening. Thanks very much. See you soon.
Thanks everybody. Bye.
Bye.